Module Overview. This module provides an in-depth, jurisdiction-specific guide on licensing and credentialing procedures for internationally educated healthcare professionals seeking migration and employment in major destination countries such as the UK, Canada, Australia, USA, and EU nations. For healthcare migrants, job opportunities often depend not only on finding vacancies, but also on meeting stringent licensure, registration, and practice readiness standards of the host country. This module, therefore, serves as the cornerstone of international professional integration, ensuring you understand the legal, educational, linguistic, and clinical competency requirements that precede or coincide with job applications. It offers granular guidance on nursing, medicine, caregiving, physiotherapy, radiography, medical laboratory science, dentistry, and other regulated professions, aligning with immigration pathways and credential assessment institutions such as NMC, GMC, AHPRA, NCLEX, ECFMG, HCPC, and more. Understanding licensing versus credentialing. Licensing, official permission to practice, usually from a regulatory board, e.g. NMC, GMC, AHPRA. Credentialing, recognition of qualifications, educational background, certifications, and professional history. How they interact in global mobility. How credential verification precedes licensure. Licensing pathways by country and profession. United Kingdom, UK. Regulators, nurses, midwives, Nursing and Midwifery Council, NMC. Doctors, General Medical Council, GMC. Allied Health Professionals, HCPC. Key requirements, English proficiency, IELTS or OET, CBT, computer-based test. OSCE, objective structured clinical exam. Police clearance, proof of good standing work visa, skilled worker route. Canada regulators, provincial nursing colleges, e.g. CNO, BCCNM. National Nursing Assessment Service, NNS. Requirements. Credential assessment through NNS language test, CELBN or IELTS, jurisprudence exam registration exam, NCLEX RN or CPNRE. Immigration stream, express entry, PNP, Atlantic Immigration Program Australia Regulator, Australian Health Practitioner Regulation Agency, AHPRA. Professions, nurses, midwives, medical doctors, dentists, psychologists, etc. Requirements, International Qualification Assessment. English proficiency, IELTS, OET, PTE, Clinical Assessment or Bridging Program, Skills Assessment for Migration, ANMAC, AMSA, United States Regulators, Nursing, State Boards via NCLEX, RN Medicine, ECFMG, USMLE, Steps 1 through 3. Requirements, CGFNS Credential Verification, NCLEX or USMLE TOEFL/IBT Visa Screen. Certificate, Employer-Sponsored Visa, EB3 or H1B, European Union Regulator, Country-Specific Medical Nursing Councils, EU-wide tools, EU-Regulated Professions Database. ECTS Compatibility Language Requirements, a 2 to B2 level of host country language recognition pathways, Directive 2005/36/EC, automatic recognition, if trained in EU, versus adaptation for non-EU. Credential Evaluation Agencies, WES, World Education Services, Canada, USA, ECFMG, Educational Commission for Foreign Medical Graduates, USA, CGFNS, Commission on Graduates of Foreign Nursing Schools, USA EPIC, Electronic Portfolio of International Credentials, Global NAS, Canada, ANMAC, Australia, UK NARIC/ENIC, UK, Language Proficiency Pathways, IELTS, Academic Version, OET, Healthcare Specific, CELBN, Canada, TOEFL, USA, PTE Academic, Australia. Minimum scores vary by country and profession. Bridging programs, exams and adaptation pathways, competency assessment programs, CAPS, OSCE training and mock tests, relicensure for gaps in training, language preparation courses linked to migration. Red flags and common pitfalls: using unrecognized agents or assessors, misrepresenting work experience, incomplete document submissions, not matching names across certificates, delayed verification causing application expiry. Learning outcomes. By the end of this module, you will be able to identify the licensure and credentialing bodies in target countries, understand the regulatory pathway to practice for their healthcare profession, prepare required documents for credential verification and licensing exams, choose the appropriate language proficiency exams and meet benchmarks, avoid common mistakes, and submit strong, valid applications. Accreditation alignment. This module meets global CPD and professional migration education requirements under World Health Organization's Global Code of Practice, OECD frameworks for skilled migration, UKNHS, international recruitment, ethical guidelines, Canadian and Australian health workforce strategies, aligns with standards of CGFNS, International Nursing and Midwifery Council, NMC, Australian AHPRA and ANMA, see Canadian NNA, ECFMG, USA, EU credentialing directives.